Claire asked the question, you know, what's the big picture? So the big picture is the undisputed evidence that children's health status at birth and in early life affects their lifelong health and their healthy life expectancy. So children born with disadvantage through poverty, chronic health problems, or learning impairment do not start off with the same life chances. But we know that health and education services can make a big difference through meeting additional needs. So that's all part of the government's levelling up agenda. So the first time in England, the eChild database makes it possible to assess how additional health and education needs are being met by health and education and how that varies across the country. So that's something that policymakers, commissioners, and of course parents need to know about potential gaps in provision. So that's the population perspective or the policymakers' perspective. But there's also relevance to for individual children and parents. So, for example, chronic health conditions are really common. About 1 in 4 children have a chronic health condition. 1 in 15 will be born preterm. 1 in 20 children have a rare disease. We now have a database that can tell us and their parents what to expect in terms of their outcomes at school, how well they're doing, how much time they need off school, and how likely it is that they're going to receive special educational needs support. And again, how that varies across the country.
I think Ruth's probably done quite an elegant point of explaining some of the problem statements and the value that having access to this type of data can sort of provide it to the department. Obviously, DFE is being policymakers for education, children's services. Sort of many of the things which Ruth talked about are very, very high sort of on DFE's agenda. I mean, obviously, all these things were always important to the department's commitment to this type of linking and this type of project predates COVID, but obviously sort of COVID is just sort of the case for this type of work has never been stronger. So as I sort of say, there is sort of the two aspects. So there's the wide range of sort of, I suppose, from a DFE perspective, just us improving our evidence base so that we are able to design, make policies, improve outcomes for all children based on data rather sort of based on our expectation or sort of understanding of sort of what would happen. So it's really just a key part of us improving our evidence base.
As Ruth mentioned, we can follow people. We can follow these children from birth in an NHS hospital through their education and see the interplay of those factors. So that's an enormously powerful asset. And having those data sets, personally, I feel we have a duty to use that data in a safe, transparent, ethical fashion to improve health and education. And as Gary has said, to make policy decisions that are based on data and based on large, credible data sets rather than gut feeling or instinct or small data sets. So this is an absolutely enormous opportunity. What's important, of course, is that we are taking people's health records, we're taking people's education records, and we're joining this together to do research on them. As Ruth has said, the research teams are not interested in individuals, they're interested in groups of children. And so we designed the system to meet that need whilst minimizing disclosure. So with the approach to how the data sets are linked and the approach to how they're used in the final database, it's all built to minimize that disclosure.
The first thing we want with eChild is the safe and appropriate use of data. And we hugely value the role of the data guardians in managing that process for us. That's a key and essential part of the project. In terms of wider issues at the moment, as we all know, there's a focus on levelling up from the government about trying to improve outcomes and services for people in greater need. And the other thing that was obvious, but somebody has to say it, obviously, is the impact of COVID on children and how we recover services and meet the demand. I think in health, we're very good at doing health research. So we look at a problem and we look at the impact on health. What eChild does, it helps us to look at an intervention, and not only the outcomes in terms of the health of an individual, but other wider outcomes such as education. And that's a vital thing. And I think really that takes the research to a different level. It's going to really help us with policy making in terms of sort of breaking down those traditional silos that we work within, so that in developing policy, we look at not just the impact of an intervention in one silo, but to the child as a whole and their family as a whole. And I think that's absolutely vital.
The Administrative Data Research UK programme is a partnership of government and academic groups led by my team within the Economic and Social Research Council. And we're working with Whitehall departments and devolved administrations to create linked research data sets from administrative sources, then making these available to researchers via our trusted research environment. So we commissioned academic and government teams to create these linked de-identified data sets for research, and the decision about whether to go ahead with a data linkage project is based on an identified need for policy relevant research that is very much in the public good, and that is tested. And we also embed public engagement into all of the projects we fund to ensure that we maintain the social contract to use administrative data for research. And the eChild study is a really good example of how to do this well, and I'm sure Ruth will be answering questions about that later. But our model is also about creating sustainable data sets where the linkage is done once and then the data is accessed securely by multiple researchers working on approved projects. And this means the researchers can all learn from what has gone before rather than starting from scratch each time a new project is started. And from experience, this saves time and resource, which at the end of the day saves taxpayers money and means research can be done more quickly. And we see the eChild dataset as a unique resource that will help government and the providers of children's services to better understand their needs and to see which groups might be falling through the gaps. And we really want to work with stakeholders, researchers and policy organisations to ensure this happens.